Hi, friend. So you just had your baby and you want to be aware of if you were to develop postpartum depression, what it looks like and how to get help. So birth is more than a medical event, as we know. It's a cultural event, spiritual and emotional. It is very emotional, and it's a mental event. It can be really hard on your psyche to do such a big thing like become a parent and open up your body in this way. So, what is normal is baby blues, and baby blues is not a postpartum mood or anxiety disorder. Baby blues are in those first couple of weeks postpartum, those dramatic mood swings where you're elated and euphoric and in love with your baby and your partner and in love with being a parent. And then those moments of maybe panic or sadness around your life changing in such a way. There might be moments when you're crying and your baby is crying, and those mood swings can happen pretty drastically. And that's really normal in those first couple of weeks, which we call baby blues. There's also dysphoric milk ejection reflex, which is DMER. Not a lot of people talk about this, but it's also not a postpartum mood or anxiety disorder. This is moments of sadness or doom or irritability that happen only when you're nursing or expressing milk. And that is not a mood disorder, but can be really hard for people to accept. And just talking about it and normalizing it can help a lot. And then we get into those postpartum mood and anxiety disorders. Those are going to occur kind of after those 2-week mark and are going to be persistent symptoms of anxiety and depression, really low lows, difficulty getting out of bed, fear and anxiety around hurting your baby or hurting yourself. And those are moments when you do need to seek help beyond just talking about it with your partner and beyond just talking about it with your community. You want to get in touch with a therapist and a psychiatrist if you are experiencing these things. Those moods are going to impact your life. That is when you know you have a disorder over just the baby blues. Suddenly you're afraid to walk downstairs with your baby. You think that they will die. Or you think that your partner is capable of harming your baby when you didn't before. And so those are going to change the way that you relate to yourself, to your baby, and to your partner. And seeking help early on can be preventative for full-on postpartum psychosis, which does happen. In which case you will want to know your crisis lines and know who to call to intervene, and make sure that you're writing things down, because when partners take their birthing parent to the hospital, sometimes it can sound like hearsay. So writing down your partner's baseline and how they're changing during postpartum can help paint a picture for providers around what is going on in terms of the psychology of that parent. If you need help finding a therapist or a psychiatrist, you can first reach out to your support system, your provider, your pediatrician, your midwife. They have a lot of experience connecting folks with some mental health support.